Good evening. We are going to talk about COVID-19 in Latin America. What are some measures, laws, and effects in the region? As we may all know, COVID-19 is a newly infectious disease discovered in Wuhan province, China. As of March 11, 2020, it was declared by the World Health Organization as a global pandemic. So many countries in the world have chosen to take drastic measures in order to prevent the massive spread of this virus into their populations. Most countries in Latin America have implemented similar prevention measures to mitigate risk regarding this virus, and we will focus mainly in Bolivia, Guatemala, and Peru, as these are our countries.
First, we're going to see the situation in Bolivia. The situation before COVID-19. Bolivia is facing a transitional government. After 13 years, Evo Morales has stopped being president, following the fraud of the 2019 elections. The country has paralyzed for more than 21 days, where people came out to the streets to protest. The country was left with a very poor health system, a huge government debt, and a country divided by political parties. On the 13th of March, Bolivia announced its first measurements against COVID-19 as two first positive cases appear. We will focus on the Supreme Decrees established on April 1st. We're going to see the economic measurements first. These are focused on four Supreme Decrees. In the most important aspects, they show measurements to modify budget of public entities and allow transfers between budget parties to fight COVID-19. All accumulated resources will be used to affront the sanitary emergency. There will be deferment of credit quota payments, and also entities and employers will not have to pay taxes for the month of April. No one will suffer electricity, water, telephone, or gas shutdown. This will be subsidized by the government. There has been the creation of a monetary bono to help more than 1.5 million people during the state of emergency. And also, there's a penalty for the ones who do not follow the measures imposed by the government. Now we're going to see the health measurements. These are based on the Supreme Decrees from 4196 to 4201. The first measure is to declare sanitary emergency and focus all resources to the contention, prevention, and treatment against COVID-19. Other important aspects of these are to guarantee all people access to health, going towards a unique free health system. All private and public health entities are obligated to follow COVID-19 protocols and to treat any patient with the disease. Finally, we're going to see the social measures. These are best shown on the Supreme Decree 4196 from Articles 1 to 10. This states total lockdown, with the exception of indispensable employees. You can only drive with a special permit. Supermarkets and other places to buy provisions are just open from 7 a.m. to 12 p.m. from Monday to Friday, where just one person of the family can earn their ID number. On the other hand, communication entities are obligated to pass educational content about the pandemic. On Saturdays and Sundays, there is total lockdown. Nobody goes out, and the military has go out to the streets to make sure the measurements are followed.
My name is Juan Diego, and now I'm going to talk about the situation regarding COVID-19 in Guatemala. The situation before the virus struck the country was normal. We recently changed presidents from Jimmy Morales to Alejandro Yamatei. We can also say that Guatemala is a very strong macroeconomic country, which will help us deal in a better way with the current situation. Unfortunately, our health system, as in many countries, is in a very bad shape. Due to the crisis, Guatemala in the last few weeks has been implementing and creating various government decrees concerning financial, health, and social aspects. On the economic side, the government issued the Decree 13/2020, which states that the government will dedicate 11 billion quetzales to help the people and businesses affected by the current economic situation. It will be distributing the money into four major funds. First, the Family Fund, which consists of 6 billion quetzales, in which it will be giving 1,000 quetzales for 2 months to families in need. Second, the Employment Fund, with 2 billion quetzales, consisting in paying the workers whose contracts have been seized 75 quetzales a day. Third, the Micro, Small, and Medium Business Fund with a total of 400 million quetzales, in which the CHN, which is Guatemala's central bank, will grant loans up to 250,000 quetzales for companies to keep afloat. And finally, the Working Capital Fund with a total of 2.6 billion quetzales. On the health side, it also issued the Government Decree 6/2020, which states that the Ministry of Public Health is obligated to evaluate people with symptoms or infected by the coronavirus. The government also started the construction of 3 emergency hospitals to treat and isolate people with COVID-19. In addition to that, the president also stated that masks are required in all public places to stop the spread of the virus, and any person will be fined if they don't obey. Unfortunately, currently, Guatemala's test for population proportion is very low, as it only has 22,500 for approximately 17 million people. The government, in response, will dedicate $1.4 million to acquire more. Finally, on the social side, Guatemala is currently in a state of calamity in accordance also to Government Decree 6/2020, in which Article 1 states that people cannot leave their houses from 4 p.m. to 4 a.m. It also says that no one can enter nor leave the country and cannot take recreational trips or participate in social events due to the agglomeration of people. Yamatei also prohibited the selling of alcoholic drinks to the public. Another topic, the Ministry of Education also canceled schools and universities until further notice. In the following weeks, the government of Guatemala will be implementing more decrees and laws as well as changing them to keep the country safe from this pandemic.
So now I will talk about the COVID-19 situation in Peru. So how was Peru before the COVID-19 situation? Well, Peru, as a matter of fact, is a macroeconomic stable nation despite political tensions that they experienced on 2019 when President Martin Vizcarra announced the shutdown of the Congress due to the blockage of the opposition and the lack of the confidence motion from the congressman to the executive. It was within the tools that the Constitution offered to the president. The Article 134 from the Peruvian Constitution facultates the president to dissolve the Congress if this one has censored or denied the confidence of the Executive Minister Council twice. So most of the important economic measures that the Peruvian government has taken would be the Legislative Decree 1455, which basically consists in injecting 30 billion soles of credits for capital in order to salvage and retake firms' activities. Moreover, we have the transfer of 100 million soles to the Public Purchasing Center in order to acquire molecular tests for the detection of COVID. Nextly, we have the partial withdrawal of PFA's funds of vulnerable individuals. This measure establishes that the person can withdraw a maximum of 2,000 soles. And also the Supreme Decree 061, which consists in giving to independent workers a bonus in order to face social isolation. Moreover, the health measurements that the Peruvian government has adopted would be the extraordinary bonus awarded to health personnel. According to this decree, this bonus would be awarded in a monthly basis. Next, we have the fabrication of basic ventilators without register, because desperate times require desperate measures. And also Emergency Decree 030, which means that the government will use Pan American villas as hospitals in order to treat patients with COVID-19. And now regarding the social measures, we have Article 137, which is the most important, which gives the president the power to dictate a state of emergency. And from this article, they've issued an emergency decree, which is basically the state of emergency due to the outbreak of this virus. And within this emergency decree, there are some articles that are so important, like the closure of all frontiers, the use of armed force in order to bring order, and also economic measures to strengthen the healthcare system, and also restrictions in the commercial, cultural, and recreational activities for the population.
After talking about the three countries, we will now discuss some similarities and some differences. Some similarities in the economic side include bonus from all three governments to its people and businesses. We can also see a subsidy in water and electricity consumption, meaning that people will be paying less for these services, which cannot be cut during the state of emergency. On the health side, Bolivia and Peru are either fabricating or buying their own ventilators. Guatemala is set to do the same in the near future. On the social side, we can again see that Peru and Bolivia have total lockdown with restrictions when it comes to going outside. We can also see in the three countries that not following the laws implemented by the governments can lead to jail time plus a fine. Some extra information includes that Guatemala and Bolivia face the pandemic in a huge exterior debt, which will be even bigger after all this.
Even though most countries in Latin America follow very similar measures against COVID-19, there are some concrete differences between the countries we've seen. On the economic aspect, we can say that Guatemala has an employment protection fund, which consists in granting a monetary help to private sector workers whose employment contracts have been suspended due to the state of emergency. Also in Guatemala, there is a micro, small, and medium business fund to help these enterprises, and we can say that this kind of measures are not taking place in Bolivia or Peru. Peru has injected 30 billion to its economy. The other country didn't react directly like this. Also, just in Bolivia, public entities can change their budgets to fight COVID-19. On the health aspects, we can say that Guatemala and Peru had been building emergency hospitals to isolate COVID-19 patients. Bolivia has not, but Bolivia did declare that any hospital, public or private, has the obligation to treat patients with COVID-19 for free. On the social aspects, we can say that in Guatemala there is no total lockdown as there is in Peru and Bolivia. Another difference is that in Bolivia, the government enforces communication entities to pass free educational propaganda about COVID-19. Finally, in other aspects we've seen, we can say that Peru has a great fiscal discipline that allows the country to react in different ways that Bolivia and Guatemala can't. And this lack of fiscal discipline from Bolivia and Guatemala can lead to financial problems in the future.
So, as a matter of fact, we will be experiencing new habits and lifestyles, especially in the Western culture. We will emphasize the use of masks on a regular basis and also keep our distance from people. Additionally, there will be a recession. Some economists said that it could be worse than the 2008 crisis, and this virus continues to make damage. So what will happen with Latin America? This is a world crisis and it will affect us all, but Latin America as a player will be seriously affected, as mostly countries' prime industries in this region are tourism and commodities. So from the economic point of view, countries in this region must have a fiscal discipline regarding their reserves and ways to find debt. And also, the countries that are currently with a high debt find ways with world institutions such as the International Monetary Fund in order to restructure debt and meet their population needs. From the social point of view, it will be needed to enforce these habits, the use of masks and the social distancing through social policies and the participation of institutions, especially for the most vulnerable population, which lack of resources. And basically, this combination of resources bring it to improve the healthcare system, which is basically one of the most important ones in order to take care of this virus. Thanks for listening and stay safe, people.